what the season brings. And that spring has started. I know the temperatures has fluctuated. We're really not sure what the day to day is going to look like, but we'll talk a little bit more about what to expect in the springtime. I'm Dr. Elizabeth Batista, currently at resident. I'm on Center Hospital working at Settlement Health Center. I just have a little agenda of the things that we will be covering. One is what environmental changes do we expect during the spring? Two, how this all relates or impacts asthma, COPD. Three, going into a little bit more about respiratory infections, specifically human metapneumovirus, which that acronym HMPV stands for, and strep, what causes strep throat. And as always, we'll circle back and make sure to tie in prevention and vaccines. So first, with the spring season coming along, we know what changes to expect as far as increased pollen production. This is the time when a lot of people have this flare in their allergies. Now they're having a runny nose, itchy eyes. They're needing to take their medications like Zyrtec, Allegra to try to keep things at bay. In just with the pollen now being in the air, we see the air quality will also change. Now it's a little bit more humid, a little bit warmer. That all affects how the overall air quality. One important thing to know is that while we love the warmer temperatures after especially dealing with the rough winter we had, that lead to certain viruses just being a little bit more stable. Just like we're happy in the warmer weather, they are also happy, which means that they're stick around. I know a lot of the times we think about the cold, everyone's getting sick, but actually we see a lot of these similar viruses stay on until early spring because of that warmer temperature. Anything that can trigger a respiratory infection, anything that can trigger if you have any underlying lung disease, underlying asthma, COPD, you likely already know that you're at a higher risk if you have a cold of having exacerbation, right? Now you're experiencing like this chest tightness, it's difficult to breathe, this shortness of breath. You might need to use your albuterol inhalers a little bit more often. And unfortunately, these are changes that we see with any seasonal transitional period, but here specifically because we're going from that colder weather to a little bit warmer. We can't control the air quality, right? These changes are going to happen. What can we do ourselves to try to reduce the risk of us developing those exacerbations if we have this underlying lung condition? So trying to reduce exposure to allergens. If you know that you're very sensitive to pollen and we can look at the forecast where we see it's a very high pollen type of day, then trying to not be outside as often, or if we need to go outside, because that's the reality for a lot of us, we need to make sure that we take our medications, be that the Zyrtec or whatever medications works best for you, because that does vary, making sure you take those prior to going out to try to avoid you feeling worse given the high pollen count. Aside from that, just making sure you're using your appropriate inhalers. There's a difference between the controller medication, which you use every day, versus the rescue inhalers. That's when you are having that difficulty to breathe. You're like, I need something quick, just like give me a pump or two, whatever, how many pumps you need, but to get you that faster relief. So making sure you have both of those and making sure you always have refills. It's also important to know sometimes we need one at home, we need at work, wherever it is, multiple settings so that we're covered no matter where we are, because you just never know. If you have asthma, and this also would go with like COPD, as far as having a written asthma action plan. And I see this a lot more in kids, like schools will ask for that because they'll have a nurse in school and they need to have a plan as far as this is what they need to use every day. This is what they need to use if they're having that difficulty breathing, like how many pumps, how often, just to have a plan in place. And that'll just help because again, these changes are going to happen. How do we set ourselves up for success? Next, we'll talk a little bit more about these respiratory infections. We all know about flu, COVID, RSV. These are the viruses that they peak in the winter. The percentage of cases that we're seeing stays pretty high up until early spring. Again, because the temperatures get a little bit warmer, it gets a little bit more humid. All of this helps and basically sets up a better setting for these viruses where they survive a little bit better, survive a little bit longer. So that's why we can't just think, oh, winter, we're no longer going to have any of those viruses. We're not going to get sick, whatnot. Still very much happens. Keeping in mind, these viruses spread, respiratory droplets. If you're talking, coughing, sneezing, all those droplets can go anywhere at any given time. So you're like, oh, how did I get sick? No one around me was sick. And sometimes it might be that they were asymptomatic. That being said, they didn't exhibit any symptoms, but they might have coughed once, they might have sneezed, and all of a sudden, a few days later, you might have symptoms. Could be because they had a virus. Most of the time, we don't know where we're getting viruses from, but things stay in the air. And then if we breathe in any of these droplets that contain a bacteria virus, it's very easy for them to multiply and grow. And then at that point, we later develop symptoms. If you're touching your mouth or nose after touching something with those droplets, so it could be the desk, if you're working at a computer, the mouse, the keyboard, think about things, even surfaces like ramps. There's so many things that we touch, pens, like think about literally any item that someone else has touched that has had some virus that might have coughed, sneezed, or whatever on that, it's easily transmissible. Also using the same plate, utensils, or as someone who's been infected. So getting very easily, and unfortunately, there's not like any sort of obvious obvious thing that would be like, oh, let's stay away. That would make our lives much easier. Some of the respiratory infections that peak in the winter as well as the early spring. So RSV, flu, and this human metapneumovirus. We always try to pinpoint the risk factors, and everyone is at risk for getting viruses, right? We're all exposed to the environment. These viruses are easily transmissible, easily contagious, but there are certain individuals that are just at higher risk of developing these infections, be that a viral or bacterial. So these are our most vulnerable populations, be that infants and older adults, those who are immunocompromised, cigarette smokers, just because, again, you're having that lung irritation, you're constantly having that irritation that's just over time going to cause changes and make you at a higher risk of developing any sort of respiratory issues. And of course, if you have any underlying lung or heart disease, that's already going to make you at a higher risk. It'll be easy for things kind of tip you over the edge. So the first virus that we'll talk about, human metapneumovirus, that acronym was the HMPV. And this one specifically, I will never forget it because something that I've seen in the children's hospitals really affects children really hard, but I've also seen it affect older adults. So again, these are populations that are at a higher risk of developing these viral or bacterial infections, and it just might hit them a little harder than someone who didn't have some underlying conditions or was maybe more so in that middle age range. But just like any viral infection, the human metapneumovirus affects both the upper and lower respiratory tract. So here I have just an image to just go over the respiratory system. The upper respiratory system, what that includes is the nasal cavity, your pharynx, larynx, your epiglottis, everything kind of above you, if you want to think like above your neck. So when you're having this runny nose, this cough, congestion, that's all in the upper respiratory tract. When we're thinking lower respiratory tract, your trachea, your bronchus, your lungs, and depending on the virus, depending on what age group you belong to, you might see that it'll affect one more than the other. So for this specific virus, we see that it affects mostly younger children and older adults. In children, it actually affects more the upper airways, where in adults, it affects more the lower. And for this virus specifically, we see that it again peaks late winter, early spring. We also see there's some records of summer outbreaks. So again, we're never truly in the clear. It's just maybe these viruses will die out a little bit when they're not as strong, not as prevalent, but they're still very much around all year round. First, we'll start off with symptoms. So human metapneumovirus, like the other respiratory viruses, they cause a lot of the same symptoms, be that cough, congestion, runny nose, which is rhinorrhea, dyspnea, any shortness of breath, any hoarseness where you're just feeling like you're losing your voice or your voice doesn't sound the same, any wheezing. So clearly there's that difficulty being able to get air in and out. And as you can see, these symptoms are symptoms that we've all had at one point in time. And at that point, typically, unless we go to the hospital and we get like a nasal swab, we don't know what virus we have. We just know it's likely a virus. The only way that we know for sure is if we test it. But that being said, the nasal swabs that we're getting in the hospital or any sort of clinic, urgent care, whatnot, they don't test for every single virus. So sometimes that something might be negative and you might have some virus that's just like not being tested for. But if you're exhibiting these symptoms, it's likely a virus. Sometimes it's helpful to know which virus, but it wouldn't change the outcome as far as knowing we have to wait for our bodies to fight out the infection. If we're having fevers, take Tylenol, take ibuprofen if you're having those body pains, making sure to hydrate if we don't have much of an appetite. So as far as how to treat viruses, no matter which one it is, it's typically the same. This is from the CDC. So there's data that's collected year round, cases that are shown here, cases that are reported. So we can see, at least for this graph, we're looking at the human metapneumovirus, so the HMPV acronym we see here. The left axis is the weekly percent positive. So that's how many positive cases we have in the country. And at the bottom, we have the week ending date. But if you really look, it's just like each month. So what you can see here is as we go through the year from August to March, we see that curve go up. And by that curve going up, we're seeing more positive cases. So you can see in October, there's a little bump up, and then all of a sudden we see that curve really coming up. Maybe it dips a little bit down between January and February, but then it's coming back up in March. So again, showing us that it's prevalent in wintertime, December, January, but then also in March, we see it's starting to become a little bit more comfortable and sticking around for a little bit longer. Here, I put the results for the flu. So the same thing, we see more cases coming up starting at the end of November, December, we see the curve going up, maybe dips a little bit, gets at its highest at the beginning of February, and then it comes a little bit down. Flu season, you really expect many cases by the end of March, but you're still seeing that variability. See that it's still very much so prevalent. For RSV, it's always been around, but what we've seen is maybe when COVID was taking over and being the major virus, these other viruses were getting stronger. So we're seeing a lot of these viruses that have always existed just be a little bit more prevalent. So again, you're seeing here, the end of October, we're seeing that uptick. It's kind of coming down at the end of January. It's not so high in March, but still higher than what it was in August and September. So clearly noticing that difference between winter and early spring. And this is adenovirus, another virus that leads to respiratory infections, also conjunctivitis, so any inflammation of your eyes, watery discharge, or sometimes can have GI symptoms as far as nausea, vomiting. This one is a little bit more over the place, but I just wanted to point out here, February to March, you see that uptick again, increasing. We have one more with COVID. Again, you see it's a little bit differently where you're like, oh, August and September was high. And this was the data for last year up until this March. So obviously every year is going to look different, but this was at least from last August. And you see that it trails off after September, picks up a little bit, maybe like end of November, December, picking up. And then we're seeing less cases now in March. CDC has all of this data readily available. So you can see that these viruses are present all year round, but how many cases we see really varies. And we see that peak winter and spring. I wanted to pivot a little bit now, instead of talking about viruses, is bacteria. So group A strep, it's a bacteria that's more common in December through April, and that's what's considered this high season. So again, following what the trajectory of what these viruses that I just mentioned follow, this now peak in winter, maybe late winter, early spring. And group A strep is one of the bacteria that are responsible for infections such as strep throat, skin infections. It's typically something we see more in children, but crusting around the mouth, it's just like a skin infection. Sometimes it could be any skin infection at any point or any part of your body, but it's usually caused by this bacteria. And this is a bacteria that is common on our skin. What happens is if we have any sort of lesion, any sort of injury, kind of enters that and can cause some sort of reaction. Obviously, not every time we get a cut or an injury do we have a bigger skin infection, but again, there's different populations that would be a little bit more at risk for developing. I put a little fact sheet here just to go over group A strep. It's a bacteria that lives on a person's skin or in their nose and throat. This is all normal because everyone has bacteria. If you didn't know, now you know, bacteria on your skin and your mouth, everywhere. There's good bacteria, there's bad bacteria, but even the good bacteria can cause issues. So group A strep, even though it's found on our bodies, it can cause many different types of infections, and many people won't ever become ill and some do. This is just because some individuals are at higher risk than others. How does it spread? If you're in close contact with anyone, if it gets to the point where they have an infection like strep throat, if they were to sneeze, cough around you, you're most likely to also get that infection. That's how we help to prevent things, to try to avoid coughing, sneezing in front of anyone else. At the bottom here, we see mild illnesses where you have this sore throat. You clearly have an infection at the back of your throat. You can get antibiotics for it, given that it's a bacteria that's causing this infection, and that should improve. Impetigo was that crusting and that skin infection I mentioned earlier that usually happens like around the mouth. And typically, if you have a viral infection, then you can sometimes develop this skin infection. Severe illnesses, so pneumonia, this bacteria can also cause a pneumonia. So that's when that infection goes down into your lungs, will cause that fever, usually a productive cough, trouble breathing. At that point, you likely will need to go to the emergency room. It'll be helpful to get an x-ray, which will show us that there's a pneumonia for sure, and then get antibiotics for that. So just an overview. Prevention. We're living in a world, we're exposed to the environment at all times. Whether we're in our homes or out our homes, we're constantly communicating with the world. And the only way to help prevent getting these illnesses is to work on prevention, be that hand hygiene. We're washing our hands, we're using hand sanitizer, masking, especially if you're sick or someone around you is sick. If they're not wearing their mask, you're wearing your mask. So at least you're helping yourself to stay protected. There's different vaccines that will just help prevent us or reduce the risk of us developing these viral infections or bacterial infections. Avoiding smoking. Cigarette smokers are already at higher risk of developing any sort of viral bacterial infection, just given the constant lung irritation that the cigarette smoke causes. Living a healthy lifestyle. I think we can always talk about how we can do a little bit better as far as eating healthier, walking around more, exercising, doing things to move our body and just keep our bodies in the best shape possible. And then controlling underlying medical conditions, because if you have an underlying condition, it's important to just try to optimize, take the medications that you need to take, especially if it's a respiratory condition that you have, making sure you're using your inhalers. If it's tablets that you're needing to take, those as well, so that you set yourself up for success. And you might get a virus, but maybe it won't hit you as hard if you're taking the medications and the precautions that you need. RSV, there's a vaccine that's available for adults greater than 60 years old. For COVID, if you're unvaccinated, there's 2 doses of Moderna, 3 doses of Pfizer. There's boosters available every year. Flu, it's an annual vaccine. Pneumonia, all adults over 65 should receive 1 dose. And those that are at high risk of developing pneumonia, there's just 1 dose of the PCV20, just one of the types of pneumonia, and it basically protects against 20 different types of pneumonia variants. And anyone who's at a higher risk of developing that condition should get 1 dose between the ages of 19 to 64. If you get once a year or once during like this specific time period, it just sets you up for success. Many of us have had COVID in the past, and the consequences of that infection affect everyone a little bit differently. If you're having coughing, breathing problems, loss of smell or change in taste, body aches, headaches, trouble sleeping, brain fog, there's so many more symptoms that we don't know of. And unfortunately, there's no test for long COVID. All we can say say is I had a positive test for COVID. And if you're all of a sudden after the fact experiencing these weird symptoms that you never had in your life before, we're likely thinking it's attributed to COVID. And we're calling it long COVID because there's so much that we don't know about this virus. Obviously, when it first came out, we know maybe a little bit more since then, but not a ton. It's probably going to take a lot more time to figure out what the true consequences of this virus is. Not everyone is going to have the same symptoms, but knowing that if you're exhibiting any of these symptoms along with many others, it's important to think, could this be long COVID? And what can we do to try to improve those symptoms? Because unfortunately, there isn't a cure, but how can we better manage? Just again, to staying up to date on the vaccine. Where to get vaccines. So a lot of pharmacies, I think most pharmacies will have walk-ins. Also, the New York City Health and Hospitals that are available are all over the city. And virtual express centers will also have them. I worked at Settlement Health Clinic. It's located on 106th Street between 2nd and 3rd Avenue. I'm one of the medicine pediatric providers, so we see both adults and kids. And that's my business card, that's our phone number. And we're always looking to meet new patients and just help anyone to the best of our abilities.